neuroscience, quantum physics, biology, plant medicine, non-dual tantric meditative practices. We will be exploring these concepts with experts to provide insight. Get ready to melt reality with us.
Dr. Kamran Fallahpour is a licensed clinical psychologist, neuroscientist, and brain-computer interface expert with over 25 years of experience in clinical and research applications of neurophysiology, health psychology, and brain health. He is the founder and director of the Brain Resource Center, where he has helped thousands of patients attain optimal brain health. His approach integrates cutting-edge research from health psychology and neuroscience to developing personalized and integrated treatments for a diverse range of psychological and neuropsychological disorders. It says on the Brain Research Center website, we use applied neuroscience to improve your brain health for peak performance.
Oh, great. Well, welcome, Kamran. It's so nice to have you here. Your clinic has been helping to innovate our understanding of the brain and to understand, that we have an ability to heal the brain, and you provide healing modalities in this regard. And we're both so curious, like, what made you get started in this? What was your early experience that brought you to the wonder of the brain and consciousness, and can you share what motivated you when you were younger to do this?
Sure, absolutely. First of all, thank you for inviting me. It's good to be with you, Jody and David. So my journey with this realm, I guess, started with when I was younger, naturally and kind of organically, people would kind of gravitate towards kind of coming and talking to me about their problems. So I was kind of the chosen psychologist or therapist within certain groups that I was with. And that kind of stayed with me. But in fact, early on, I was more interested in physics and architecture. But finally, I found myself, for a variety of reasons, going back to psychology, kind of something that came naturally, and I was interested in people, understanding the human brain, and very interested in consciousness. So sort of gradually decided that was what I was going to do. And originally, I went to Cal State LA and started in psychology. When I was actually doing my rotations and studying as a student, I also early on started working in the field, working with the severe mental disorders, started working with various populations with developmental disorders. So all of that kind of gave me an understanding of psychopathology, but also the brighter side of human consciousness, and how the both sides of this, how the human potential has capacity to go either way. And to date, obviously, at my center, we treat some severe psychiatric neurological issues sometimes, like brain injury, stroke, and so on. But we also work with people who are really just interested in peak performance, and they're interested in actually improving brain functions, cognition, and they may not necessarily have any psychiatric issues. So I really enjoy that whole spectrum, and I've worked in the past with people who are in coma, vegetative states, minimally conscious states, all the way up to people who are like leaders in the field, CEOs, top athletes, and people who are like real peak performers. So that's been a privilege, I would say, to be able to do that.
So let's dig into psychopathology, ADHD, depression, anxiety, brain injuries, addiction. Can you give us some sense about your overall philosophy treating these kinds of psychological ailments at the center? What is your overarching philosophy with these kinds of disease states?
That's a very good question. So, when you go through your training as a clinical psychologist or you go and work in psychiatric. You've done rotations in inpatient psychiatric wards. I've done in outpatient psychiatric wards. So our culture and our kind of medical system is very much centered on psychopathology and focusing on what's wrong with people and so on, which has a utility, obviously. So, for instance, the DSM, that has had many versions and keeps getting updated, has these clusters of symptoms that are kind of boxed into this diagnosis versus that diagnosis and kind of differential diagnosis. And they're all very useful tools as long as we don't take them too literally and too seriously, in my opinion. In other words, all of that knowledge is there to be able to kind of put certain labels on kind of people for the understanding of what are the common symptoms for someone with bipolar or versus just unipolar depression or ADD versus ADHD. But while those labels are sometimes very helpful to communicate with other clinicians or even with patients, my approach is that my patients are not defined by those labels because from various points of view, each individual is so unique and their brain is so unique and their personality is so unique that those labels don't do justice, even though they are helpful in communication, especially clinically.
It's such a compassionate approach. It's such a compassionate way to look at an individual.
Well, thank you. But I also think it's a very, at the same time, very objective approach because I've seen hundreds and hundreds of people with ADD, ADHD, depression, stroke, brain injury. They're all different. They may have certain elements, certain symptoms in common, but they're all individuals with the same diagnosis that present very differently. And what's interesting also is that when we do their brain map, even though, let's say, someone with depression, anxiety, ADD may have certain brain signatures that when we look at topographies, when we look at brain dynamics, there's certain things we look for. And a lot of times we find it based on diagnosis, but they're also very different. Each one has a unique brain dynamic and profile. Each person has a different cognitive profile. And I think we should be interested in that. We should know more about our the kind of workings of our brain functions, cognition, and so on. You know, maybe about 100 years ago forward, from the time of Freud forward, you know, we became very interested in understanding our subconscious and understanding what's beneath our level of consciousness, which is still very relevant, right? And I would argue that these kinds of biometric data, these kinds of information about your brain dynamic, my brain dynamic, cognition, personality, there are other facets of information that are so useful, and they have the potential to open up doors to, you know, expanding our consciousness, improving, you know, our, you know, performance in the world, whether it's work, interpersonal, social, and so on. So great. So great. So a QEEG, of course, is a brain mapping device that details the electrical activity in the brain. And if a person came into your clinic and was scanned, what exactly would they learn about their brain? Like, what do you see within that experience? Great question. So I would say I would see the evidence of any symptoms that they have been suffering from. I would also see the evidence of certain strengths that they might have. I would say that, like, for instance, if you take someone with let's say ADD or ADHD, who may suffer from things like lack of attention, concentration, hyperactivity, poor executive functions, impulse control issues, and so on. So not only we can kind of identify what regions of the brain are overactive or underactive, but also how the different parts of the brain talk to one another. And then what are the implications of that? And when you add that information to their cognitive profile, which means, well, do they have trouble with memory? What kind of memory? Is it short-term memory, long-term memory, memory recall, recognition, again, executive functions, verbal fluency, cognitive flexibility. When we look at all these and kind of bring this information together from their brain dynamics, cognition, and then their own life story and their goals, we kind of get a beautiful picture of who this person is and what are the areas they need help with, what are their strengths, and depending on their goals, we can then help sculpt their brain development in such a way that is aligned with their goals and values in life.
So you're saying that there's actual tools that you would give or practices that strengthen areas or enliven neurons in the brain? Is that what you're suggesting?
Absolutely. So imagine that, our brain, various regions, there are neurons that basically these are electrochemical reactions that happen. There's a neuronal firing in the brain that happens. And not only we can measure those, we also have norms that are based on age, sex, and level of education. So we can take your brain dynamic or someone else's brain dynamics, compare it to norms that are appropriate for you, and find out how it differs from the norms. But then the bigger news here is that then we can actually help rewire the brain based on the principles of brain plasticity and operant conditioning, and actually help rewire the brain to strengthen certain areas. There is a beautiful phrase in neuroscience that says neurons that fire together, wire together, which is really the basis for brain plasticity and learning. So our brain is very much capable of rewiring itself if we give it the right context, the right information, and it's able to learn how to make a region more active or less active. And through that process, we can actually help improve mood, self-regulation, attention, focus, memory, and many other facets of our cognition and emotional life.
Wow.
And that technique is called neurofeedback, broadly speaking, right?
Yes, although neurofeedback, I would say, is a very general term because there are many forms of neurofeedback today, and there are many protocols, there are many approaches, and in some ways it's like saying medication, but what kind of medication? How is it applied? And however, absolutely, neurofeedback is a big part of it, but there are other approaches as well. So, for instance, there is also TDCS, that's transcranial direct current stimulation, that actually has a very tiny charge that helps stimulate parts of the brain or inhibit. There's also for conditions like treatment-resistant depression, there is RTMS, which is repetitive transmagnetic stimulation, which is basically a magnet that has repetitive stimulations that wakes up certain areas of the brain. Very fascinating kind of technology as well. But there are various methodologies, but I would say most of them, all of them almost, they help basically reshape and regulate different parts of the brain and the human nervous system.
I see. So you have these tools that you can use to sort of, as you say, sculpt the brain once you have a hypothesis or a theory as to what's wrong with the brain in a particular individual, or where their brain is suboptimal. Is that generally right?
Absolutely. And of course, that hypothesis is backed by objective measures of looking at actual brain maps, cognitive performance, and of course, also the patient's history, background, symptoms they've had, what has worked for them in the past. Oftentimes, when we have a patient come in, they've already been to 10 different doctors, and some of it has been helpful, some of it has not been helpful. And all of that information helps in really planning a personalized treatment plan for them.
So you have these tools, these great tools now in your toolbox like QEEG that allows you to actually map the brain and get a hint as to where certain regions might be suboptimal. And then you have these other tools to kind of sculpt and fix these things that you're observing. And you put that all together with the clinical picture, and is that broadly speaking the approach that you use in your practice?
Absolutely, all of the above is true, and of course we still use, when needed, more traditional approaches like cognitive behavioral therapy, DBT, CBT, some insight-oriented approaches. When needed, we also do the talk therapy, but what we find is that most of the time we can get much further using these modalities that go beyond just talking about problems or even kind of learning new skills. One of the things that has been very eye-opening for me from the start of my career has been that even though insight is very important, and it's beautiful to have insight into one's own kind of problems, the source of problems, and kind of the details of one's symptoms or tendencies, just the insight itself is not going to solve the problem.
Yeah,
and
no.
that's an awakening that I think many people have had about the fact that insight is great, being aware is great. It doesn't always lead to change in behavior or change in how you feel, whereas these methodologies actually can help change that.
Yeah, there was a fascinating, I don't know if you saw the 60-minute piece on Alzheimer's with Dr. Ali Rezai, but it's a more, I guess you would call it, aggressive approach, going into the brain in surgery and putting in an electrodes in the brain.
Yes.
And I wondered if you had any comments on that. I know that there's been some very interesting outcomes with this technology.
Absolutely. I think that technology can be quite helpful with certain types of neurological disorders when it's severe enough that really justifies that kind of intrusive, aggressive approach to obviously open up the skull and the brain and insert an electrode in there, stimulator in there. It can save lives for some people, and it can enhance quality of life tremendously.
It was even working on it with drug addiction, and all of a sudden the person would come out of the surgery like, I have no craving left.
Right. Because the brain is obviously controls everything that happens in our nervous system, from hunger, drives, our behavior is basically, at least brain is the interface, if not more than that. So through stimulating certain areas or inhibiting certain areas, we can certainly change those things. The question is, cost benefit. The question is, like, if you have such severe depression that nothing else has been helpful, then, that might be an option, or Parkinson's disease that, basically nothing else has helped, or very severe types of seizures, or this or that. However, I also want to argue that today we have access to many other methods that are much less intrusive
Mm.
that can be actually used, that can actually help with not everything, but certain symptoms that people may have, that maybe medication doesn't help, maybe definitely talk therapy can't help. And those methods are being underutilized.
Yeah, that's fascinating. Well, I met you when you were demonstrating a classical music performance and its effect on the brain. Can you talk a little bit more about that work? Because it was so fascinating.
Sure. So music, we believe music is medicine, and music has been used in various cultures around the world for thousands of years as what we call a neuromodulator, is as a basically a stimulant or as an agent that can either stimulate the brain or it can do the opposite. It can actually calm down the nervous system. In fact, there's been evidence of the use of music in medicine from, within various cultures thousands of years ago. Now, through neuroscience in the past few decades, we're coming back full circle through the door of neuroscience and rediscovering some aspects of maybe the knowledge that has been lost, and some of it we have, but we just didn't know how it worked. And through fMRI studies, EEG studies, and other studies that have been done on not only mood, but also cognition, we have been able to demonstrate that music impacts the brain in very positive ways. And one of the things that's very interesting about music is that, number one, is a very sophisticated type of communication that it can be much more impactful than language in certain ways. In fact, some theorists believe that music preceded language in human evolution. So that's one aspect. The other interesting dynamic about music in this way, in terms of the therapeutic aspect of music, is our brain really experiences music in a very unique way. And I say unique because with any other sense, you have certain areas of the brain that light up or stimulated. With music, almost every part of the brain is stimulated. From premotor to motor, to executive functions, to judgment, to kind of identifying rhythm, novelty, expectation, emotional centers, limbic system. I mean, every part of the brain is touched by music. The question is, to some extent, what kind of music and why and when. So everything matters in our opinion, from the intention of the composer all the way down to the psychoacoustics of the instruments, the delivery, and obviously the audience as well.
It's incredible. I had the privilege of meeting Teresa Schroeder, who started as a student, a music student at a nursing home. She realized that this man who was dying relaxed his body with Baroque music. And Absolutely. So her graduate thesis was on what kind of music would help a person just relax and slip into death, slip into a calmness that would let them leave this body. And she created music thanatology and has hundreds of musicians around the country playing a classical Baroque music in hospitals. And I just think that's a fascinating area of study as well.
Absolutely. I can tell you that just one aspect of music, which is just movement. When I was in Los Angeles, I was going to school then. I was going to Cal State LA studying psychology. I had a rotation. I worked at this center where they had developmentally disordered individuals who were severely impacted by their disorder. And they had very limited communication and very limited movement abilities. They would basically be in a class all day. Pretty much they were babysitting them. Would be minimal movement, minimal communication. They would feed them. They would maybe do a few exercises in terms of giving them something to do, draw something, this, that, until we started actually implementing a music therapy program there. And basically, I saw these individuals who were like almost catatonic looking. They were not like expressive with their body. They were like in a corner, basically just very limited movement. They would start to dance with music, and they would start to move. And we know movement in itself is such a stimulant for the brain and helps brain development and so on. So I've seen firsthand from a couple of decades ago the power of music on that spectrum of people who would have severe developmental disorders, to people that later on I was exposed to who had more like emotional, maybe mood issues, attentional issues. And that's when, I've also had a passion for music myself. That's when I started to integrate music as a neuromodulator into some of the neuroscience work that we were doing. So some of the neuro training we do involves music, and we use music as a reward to the brain for doing the right thing. So when the brain fires in synchrony the right way, we would actually use aspects of music to reward and reinforce that based on operant conditioning paradigms and so on. So it's been a very successful methodology for us.
It's so intriguing, so novel, and so innovative. Speaking of innovative, I'd like to, as a neuroscientist and a FDA regulatory consultant, something that's been high on my radar lately has been, psychedelic therapy, psychedelic treatment. Have you been involved in this at all? Do you have thoughts on the utility of psychedelics in the treatment of actually just optimal performance, like you said before, as well as in people with psychopathology?
Absolutely. Well, there's been a long history. You probably know better than I do. There's been a long history of our species using psychedelics for any kind of medicinal to enhancement of consciousness, perhaps, or at least those are the claims. That goes, we don't know how long it goes back, but some people even theorize that the human consciousness evolution and human beings becoming more conscious of themselves and progressing the way we have has been
Terence McKenna. Is that
exactly.
Yeah.
So there's all those theories, and there may be some credence to those theories. But what we know more scientifically, but not just theory, but also through research, is that there was a famous Harvard study that looked at the impact of psychedelics when regulated and dosed properly with the involvement of clinicians within clinical settings and so on, were very helpful for PTSD patients and some patients who had severe depression, PTSD, and so on. So we know that psychedelics can have a role, and they can have perhaps a future role in psychiatry and maybe even neurological treatment of some sort. But as usual, obviously we can't jump the gun and just make it readily available everywhere, because there are many reasons why it could also be harmful if it's not dosed right, if it's not regulated. I'll give you examples. In my own practice, I've seen young adults who use psychedelics, who use something even as simple as marijuana. And it started a whole cycle of psychiatric breakdown, of, there are some people who are just predisposed to those things, and sometimes these agents, psychedelics, or even something as simple as THC, can actually trigger a gene or trigger a reaction that can then spiral down into a lifetime psychiatric issue that then is hard to control. So I think there's a lot of potential, but we also need to be very mindful and very careful about how to curate it. Now, I've been kind of in observing sessions where we tried to do we observed brain activity during ketamine treatment, which was very interesting. And one of the things that we believe will happen, and we may be involved with it, we've been talking to some companies already about this, is the curation of something like the ketamine treatment, or let's say if there's psilocybin treatment, that often takes hours, to use very intentionally the type of music that we produce that actually curates the journey to make sure that certain networks are tapped into, that perhaps there more guardrails for that experience. So these are all places that hopefully in the future we'll tap into.
Music and psychedelics, that is so cool. We had a colleague, a doctor on our program who has a kit called Miraculix that's in our show notes, that helps people who are wanting to microdose at home or dose at home understand the dosage that they're taking, so that they're within a range. And that product is always within our in our podcast and in our show notes, because we want people to be really safe and knowledgeable as they use these substances. I wanted to, we always ask our guests about the ego, and how in your case, how you think about the ego in your work, and as well as sort of the solidity or concretization of the ego versus an ego that's more fluid or more relaxed. And I wonder if you have any insight about the ego in your work, and what you could say to us related to it.
Yeah, it's a very interesting question. And I think the question of the ego, it depends on who you ask. Now, if you ask a neuroscientist, there's maybe a bit of a different answer than a psychologist, than someone who's a mystic, let's say. So for instance, if you think about kind of the Freudian approach, ego has no real entity. It's a functional entity. There's no place in our brain or in our being that's actually an organ called the ego, but it has a functional identity. And according to that mindset, it kind of is that sense of self, and it is the negotiation between the realities and the ideals, and the maneuvering of that. And I want to add to it that that's when we get into who is the self? Is there really a self? And I don't mean it in a pathological way, because there are psychopathologies where there is no sense of self. There is no sense of identity. And one can then become, a narcissist or a borderline, or so on. But there are also, according to some traditions, and mystic kind of mystical ideas, that the lack of ego, or the disintegration of ego, is actually, that's when people see that everything is one, and there is no differentiation between me and you and everybody else, because everything is one. And if you want to subscribe to that mindset, then you have a much more fluid kind of idea about ego. And in a way, ego doesn't exist. It's a fictional character that has a function.
So cool. I always say that it seems like it's a tool but you're right. Like, where does it exist? It certainly has a strength. It's like it's a militant. Like, it can be super strong at times, and also, rigid in its ability to, I think, limit the mind and concretize thinking. But so this is a great a segue into this question about consciousness itself. Some scientists, some philosophers are saying that perhaps consciousness makes up reality itself, and so there's this real debate going on about matter being consciousness being inside of matter, or matter being inside of consciousness. And I wondered if you have any thoughts on that.
Well, it's something I think about a lot without maybe making a lot of progress with it, because by definition, consciousness and understanding consciousness, we're trying to use a tool, which is our own consciousness, to understand the nature of consciousness. So by definition, that's not going to work. So that's the problem. The tool, and you know about this, like, as soon as you observe anything, you change it.
Right.
So the nature of consciousness is changed as soon as you pay attention to it or you focus on it. And we are trying to actually understand it through our own consciousness. So, which kind of makes it more difficult to bring together. In fact, in quantum physics, you've probably heard many times that one of the statements is like, if it doesn't confuse you, you have not understood it. And, it must be confusing, because we're using the tool to understand the nature of it. And that's very confusing in itself. Having said that, I think that, again, we are probably at the infancy stage of understanding some of these kind of quantum mechanics and quantum physics phenomena. But, some neuroscientists agree, and I tend to gravitate a bit towards that, is that the brain is actually happens to work on a quantum level. And it happens that our perceptions, our encoding of information, all of that happens at a level that regular cause and effect, if you follow that, can't quite explain what happens in the brain. So I would say that from that point of view, that level of consciousness and understanding that is a quantum phenomena, where we are still trying to kind of understand the depths of it, because basically we've been socialized into believing everything on a different level of physics, and the two can meet, but they're not exactly the same.
Wow, wonderful. Well, Kamran, before we let you go, is there anything you want to tell us about what's next for you? What's your focus for 2024?
Well, a couple of things. I think I mentioned to you that we developed this device that it's a brain monitoring headphone that helps retrain the brain, similar to some of the neurofeedback principles. So we're trying to use that for kind of be able to use it in more research, but also in clinical, and more, I would say, in such a way that more people are able to utilize it. But some of the same discussions about kind of exploring the potential connections between brain dynamics and quantum mechanics, and some of the mechanisms by which brain connection, connectivity, coherence point to the same quantum phenomena. are areas that I'm personally interested in. So I'm hoping that maybe in 2024-25, we can tap into some of the research of that. Also, I'm in collaboration with Dartmouth, some of my colleagues there at Dartmouth College, exploring some music and aspects of music. We did a 2-day seminar on music and the impact of music on the brain and neuroscience about a year and a half ago. So we got a bunch of neuroscientists together to talk about that and talk about how neuroscience has focused mostly on Western music and how we should start to shift and include Eastern music into neuroscience exploration. So that's another area that we're interested in and trying to get more kind of research going. So we've already started doing some things, and hopefully maybe by the time we have a next conversation, I might have some information for you on that.
Well, it sounds like you will not be at a loss for things to do in 2024, and we would love it if you'd come back and tell us about it. Kamran, thank you so much for your time today. We really, really appreciate it. And to learn more about Kamran's work at the Brain Resource Center, you can see our show notes. Thanks again, Kamran.
Thank you very much, David. Thank you, Jody. It's been such a pleasure talking to you both.
Thank you so much, Kamran.
Thank you. Hope to see you soon. Bye-bye.
Now, this is cool. The music you have been listening to is actually my consciousness in motion. To create this hypnotic music, Marcia Britskaya of NextVox and her team connected musical notes to the frequency of my brainwaves from gamma to delta. The team at NextVox will be exploring how listening to your own brainwaves can provide health benefits from reducing your blood pressure to calming anxiety. Visit our show notes to learn more about NextVox.
Exploring Reality Maybe is written, produced, fact-checked, and edited by Jody R. Weiss and David Schwartz. Research support is provided by Semicolon Connects. Music produced by NextVox. Visit our website at exploringrealitymaybe.org to find show notes, transcripts, bios, and to learn more. If you like the show, please visit our website to donate.